Good evening. Could I have the first slide, please? Thank you. On the 16th of April, we set out our 5 tests for adjusting the lockdown, and since then they have guided our path. At every stage, we've diligently assessed our progress against these 5 tests before making changes, and it has meant that we have so far avoided the catastrophe of a second peak of infection that could have overwhelmed the NHS and meant so many more lives lost. Next slide, please. So our first test is to protect the NHS's ability to cope, so we're confident that we're able to provide sufficient critical care and specialist treatment right across the UK. Well, the NHS coped fantastically under the extraordinary pressure of this pandemic. On the 20th of June, 283 people were admitted to hospital with coronavirus in England, Wales and Northern Ireland, down from 438 2 weeks earlier, and down from a peak of 3,432 on the 1st of April. And on the 22nd of June, 340 patients with coronavirus were in mechanical ventilation beds in the UK, down from 513 2 weeks earlier and down from a peak of 3,301 on the 12th of April. These numbers provide confidence that we are still meeting the first test. So the next slide, please. Our second test is to see a sustained and consistent fall in the daily death rates from COVID-19, so that we're confident that we've moved beyond the peak. Of those who've tested positive for coronavirus across all settings, it saddens me to report that 42,927 have now died. 171 fatalities were reported in the 24 hours till 5 p.m. yesterday. A further 109 deaths, which occurred in April, May and June, have been identified and added to the total. As measured by a 7-day rolling average, the UK daily death rate now stands at 121, down from 216 2 weeks ago and down from a peak of 943 on the 14th of April. The second test, therefore, is still being met. Next slide, please. Our third test is to receive reliable data from SAGE showing that the rate of infection is decreasing to manageable levels across the board. In total, 306,210 people have now tested positive for coronavirus, which is an increase of 874 cases since yesterday. The 7-day rolling average of new positive cases is now 1,147, down from 1,543 2 weeks ago, and down from a peak of 5,195 on the 14th of April. Approximately 1 in 1,700 people in the community in England are now estimated to have the virus, which is down from 1 in 400 4 weeks ago. SAGE believes infections across the UK are shrinking at a steady rate of between 4 and 2% every day. Based on all the various data available, the government is confident that the third test is being met. Next slide, please. Our fourth test is that we must be confident that the range of operational challenges, including on testing capacity and personal protective equipment, are in hand with supply able to meet future demand. Yesterday, 237,142 tests were carried out or posted across the UK, compared to around 12,000 at the start of April. The new NHS Test and Trace service has already advised over 87,000 people to self-isolate who might otherwise have unwittingly transmitted the virus. We have contracted with over 175 new suppliers able to deliver PPE at the scale and the pace the UK requires, and this progress means we are satisfied that the fourth test is being met. Next slide, please. Our fifth and final test is that we must be confident that any adjustments to the current measures will not risk a second peak of infections that might overwhelm the NHS. I'm once again grateful to the Chief Scientific Advisor and the Chief Medical Officer for their advice on the measures that I'm about to set out. I can confirm that the government judges that we have met the fifth test and we're therefore satisfied that all 5 tests are still being met. So on the 11th of May, we set out our plan to recover. And that plan, as you may remember, set out 3 steps for adjusting the lockdown. Step 1 was implemented as we set out on the 13th of May, enabling people to spend more time outdoors. Step 2 was implemented as planned in phases on the 1st and the 15th of June. Shops have opened, children have started to return to school, and people have been able to see more of their loved ones. Now, step 3 can be implemented as planned on the 4th of July. All the measures I am about to set out apply to England. Of course, the devolved administrations are responsible for adjusting lockdown in Scotland, Wales, and Northern Ireland, moving at the pace that they believe is right for them. After a long period of asking you, the British public, to follow very strict and complex rules to bring coronavirus under control, we can now make life easier for people to see more of their friends and family and to help businesses get back on their feet and people back into jobs. Critically, we can make a change to the guidance on 2 metres, which kept us safe while transmission of the virus was high, which can now be modified. Having considered all the evidence, while staying at 2 metres is preferable, we can now move to 1 metre plus, where it is not possible for us to stay 2 metres apart. That means staying 1 metre apart plus mitigations which reduce the risk of transmission. And these precautions could include installing screens, making sure people face away from each other, providing hand washing facilities, minimising the amount of time you spend with people outside your household and of course being outdoors. On public transport, it already means 1 metre plus means wearing a face covering for mitigation, as everybody, I think, now understands. We are setting out COVID-secure guidance to help businesses to take the measures that are right for them. We can also allow more sectors to reopen on the 4th of July as planned in step 3. So, from the 4th of July, the following premises will be allowed to reopen provided they are COVID secure: hotels, bed and breakfast and self-contained holiday accommodation, caravan parks and campsites, places of worship and libraries, restaurants and cafes, bars, pubs, social clubs, cinemas and bingo halls, museums and galleries, hair salons and barbers, outdoor playgrounds and outdoor gyms. This has been an incredibly tough time for all these establishments, but I hope that everyone working in them can take confidence in knowing they will be able to open their doors once again in just a couple of weeks' time. And of course, it goes without saying they should do so in a way that is COVID secure, keeping customers and staff safe. But I'm afraid to say that as things stand, some premises, such as nightclubs, swimming pools, indoor gyms, must remain closed for the time being, given the particular risks of transmission in those settings. However, we are establishing task forces now for those sectors to establish how they too can open in a COVID-secure way as fast as possible. At the same time, we can give people more freedom to see their friends and family. From the 4th of July, your household will be able to meet with one other household at a time, including staying over. This can be indoors or outside, at your home, in a restaurant or pub, or in paid accommodation. I want to stress you should remain socially distant from anyone outside your household. For meeting outdoors, you can continue to meet in a park or a garden in a group of up to 6 people drawn from 6 different households. Again, at all times you should maintain social distancing from anyone outside your household. As we give people back more control over their lives, we will be asking them to follow guidance on limiting their social contact rather than forcing them to do so through legislation. And this obviously requires everyone to act responsibly, which I have no doubt they will do. It will still be possible for the police to break up large and irresponsible gatherings, but neither the police themselves or the public that they serve want virtually every aspect of our behaviour to be subject to the criminal law. Yesterday, the Deputy Chief Medical Officer and the Health Secretary set out updated advice for those who are shielding in England so that they can soon start to return to leading more normal lives. Opening up more of Britain in this COVID-secure way is only possible if everyone continues to stay alert to the risks of coronavirus. That means you should stay 2 meters apart. If you can't do that, then keep 1 meter apart with mitigations. Wash your hands regularly. Wear face coverings on public transport or where you are indoors in a crowded environment where distancing is not possible. Follow the rules when visiting businesses. Crucially, get a test done immediately if you develop symptoms, and self-isolate if you're asked to do so by NHS Test and Trace. We're only able to make these changes because we have persevered together and stuck to our path. We had 5 tests and we met them. We had a plan and we stuck to it. The government has asked a huge amount of all of you, and you've met that challenge, the people of this country have met that challenge with good humour and common sense. Of course, the fight is far from over. This is a nasty virus still that wants to take advantage of our carelessness. There will be, I'm afraid, there will be local outbreaks. And I must tell you that if the virus were to begin to run out of control, I will not hesitate to put on the handbrake and reverse some of these changes at local or indeed national level as required. But we can avoid that if we all continue to stay alert and do our bit to control the virus. The British public have proved again and again, not that it was ever in doubt, that they can be trusted to do the right thing and to do it with common sense. That there is no doubt we're beating back this virus, and with your continued cooperation and good judgment, we will beat it once and for all. I'll now hand over to Chris. No, to Patrick. Sorry, to Patrick.
First slide, please. So just to go over some of the numbers to remind you, the latest R value for the UK is between 0.7 and 0.9. That seems to be below 1 everywhere across the UK. We're getting updated numbers again later this week. So everything looks like the numbers continue to go down and the epidemic continues to shrink, albeit slowly, at a rate of something between 2 and 4% per day. Next slide, please. This indicates from the ONS, the Office for National Statistics survey, what the estimate of the number of people with COVID is in the UK. And you can see it runs from the 25th of April through to the 13th of June. And there's a steady decrease in the number of people with COVID from somewhere above 0.3% to 0.06% of the population with it. But you can also see that it's flattening off. It's not going right down to 0. And that's important to remember. The infection is still here. Next slide, please. Estimated 33,000 people with COVID infection in the community over the period of the study, most recent period of the study. That's 0.06% of the population with COVID still present. And just as a reminder, something in the order of 5% of people have antibodies to this disease now, suggesting that the number of people who has been infected is still limited across the UK, and most of us have not had the disease and therefore remain fully susceptible to it. Next slide, please. Unfortunately, many people have died, and this shows the figures for deaths against the average over the past 5 years. So in the top curve, the green curve, you see the deaths for this year with the peak, which is due to COVID. In the dotted line, you see the average for the 5 years previously. And what you can see is that we're coming back down to average levels of death for the UK now. And that's due, in the purple line, to the decrease in COVID deaths and the other consequences of the COVID infection. So it is coming back down towards baseline, towards normal. But don't be fooled that this means it's gone away. The disease is growing across the world. It's coming down in the UK, but it hasn't gone away. And we need to be absolutely sure that with the new relaxation, that we stay rigorously to the things that need to happen in order to stop the spread, contact to contact, to stop the networks of spread developing, and to make sure that COVID secure really means COVID secure by the way we all adhere to it. Thank you.
Thanks very much, Patrick. Chris, did you want to add something?
Just add a few comments, Prime Minister, to what you said from a medical point of view. And this is really because all of us in every country are having to find a sustainable balance because we have to live alongside this virus for the foreseeable future and find a way. No decision is going to be risk-free. It's about finding a balance of risks that allows us to operate in a reasonably normal way for a prolonged period. And I think it's just worth situating the decisions that have been taken in terms of the multi-layered defence that all of us have to be part of to stop this coming back in large numbers. The first thing is we all need to take part in isolating the virus. If we have symptoms of cough, of fever, of losing smell or sense of taste, then we must self-isolate immediately and we must ask for a test. We must get our households to self-isolate, and that's because if we have got the virus, if I have got the virus, then the rest of the household have a very high chance of having caught the virus. And then if the test is positive, NHS Test and Trace will try and find close contacts over the previous few days so that they can be isolated to make sure that anyone with the virus who hasn't yet developed symptoms is taken out of the general population at home, and that reduces the transmission. So that's the first thing, isolating the virus. We all have to be part of that. The second is we all have to do the things which individually make it harder for the virus to be passed on. Washing hands, absolutely critical, because one of the ways you pass it on is by touching surfaces that have been contaminated. Covering mouth for coughs, and wearing face coverings in situations where you can't keep a distance, such as public transport or many shops. But the third group of things that we have to do are things which link households together. And a lot of the changes made today are around the way in which we reduce the risk of transmitting between one household and another household. And some of that is trying to encourage people only to have 2 households at any given time indoors, with a bit more flexibility outdoors, because the risk is much lower, it's not 0 outdoors. And then in environments like shops and restaurants and pubs, to make sure that we can meet together in a safer, not completely safe, but a safer way. And a lot of the changes are about emphasising things that we can do. And it is really critical that individuals and firms take these really seriously, because if we don't take them seriously, then chains of transmission between households will be re-established. And they include staying at 2 metres if people can, If that is not possible in a particular environment, there are several things, as the Prime Minister said, which can be done to reduce the risk so that it is broadly similar to what it would be at 2 metres. These include things like orientation, making sure people are not face-to-face. It might include physical barriers. It might include things like ventilation. It might include face coverings, and it certainly includes, in all situations, regularly cleaning areas that people frequently touch. But there's a long list of them. There's what's known as 39 steps of different things which people can do to improve the chances that people will not pass on the virus, even if they have it, without knowing about it. And then the final two, the shielding programme for the most vulnerable people, which the Prime Minister's talked about, which we've had modifications to that were talked about yesterday, and the very final one, which is one more widely, which is the effort of science to come up with cures, with vaccines, with diagnostic things to help us. And the paper from the UK that looked at dexamethasone showing that reduced mortality was published online today, for example, as one of the first steps to get on top of this from a science point of view. But to be really clear, it is absolutely critical that every individual, every household and every firm takes these precautions seriously, because if that does not happen, we will go back to a situation where transmission starts to rise again. Thank you very much.
Thanks very much, Chris, and thanks, Patrick. Let's go to questions. Actually, before we go to questions, I should just want to tell everybody that we're going to be winding down, I'm afraid, the rhythm of these press conferences, though I know that they've become a great point of focus. And I want to, that's basically because we're continuing to make great progress in controlling the virus, and we want to make sure that we have something really important to say. I want to thank Chris and Patrick for their really heroic work in presenting information to the public so clearly and so powerfully. And I want to stress also that we will, of course, be keeping you informed. As I said, I'm afraid there probably will be more outbreaks, certainly local outbreaks, and I don't think, therefore, that you've seen the last of us by any means, but they will not be happening as often as they have been. However, we will be making sure that all the information that you want, that you normally get in the slide packs, will be available on the website at gov.uk. Now, we're going to go to our questions, first of all, from the public. Can we go first to Suzanne in Chesterfield? Suzanne.
When will primary care and dental practices be encouraged to work normally again, now that the threat level is at 3? We are seeing large numbers of patients referred to the emergency department because their GP or dentist are refusing face-to-face consultations. How soon will they be getting back to normal?
Right. Well, thanks very much, Suzanne. As far as I know, we dental care certainly, and primary care, dental care we got back a few weeks ago, and in the NHS and primary care should be functioning as normally as possible. We do want people to be taking advantage of this moment to, if they do have conditions that need to be attended to, go to your doctor, go to A&E. One of the most important successes that we've had is protecting NHS capacity. We don't want to see people suffer through not now using the NHS, Suzanne. But I think I should probably ask the Chief Medical Officer to give some further comment.
Thank you, Prime Minister. The general practitioners, GPs, have of course been working throughout this and done an absolutely fantastic job, if I may say so, to my colleagues, inevitably to reduce the risk of transmission, to reduce the risk that people come into contact in waiting rooms and indeed between clinical staff and patients. They have changed the way they've worked, and many of those changes are actually things that make sense for the longer term, even if it wasn't for coronavirus. But of course, they're having to go step by step back to a more normal way of providing the care that they always have and they always will. But there is a steady movement in that direction, and GPs are working the whole time to try and improve that. Dental care was a slightly different situation, and emergency care obviously continued throughout the period, but it is particularly high risk because you're generating a lot of potentially potentially aerosols, certainly a lot of droplets around people's mouths where if they were infected, you're getting very close. So the people had to be very cautious about this, but as the Prime Minister has said, dental work has again started it up again, carefully at first, but gradually people are finding ways of operating which actually are going to work in this new environment we will be in for a really quite prolonged period.
Brilliant. Thank you very much, Suzanne. Let's go to Christine in Lincoln. Christine asks, coronavirus has been found in meat processing factories. What steps are public health taking to protect the public from contaminated meat, finding out why this is happening and protecting the production workers? Well, this is a very good question which has come up several times with me today. We are aware of this particular issue with meat processing factories. I think that both Patrick and Chris might have something to say on this. Patrick.
Well, I'll maybe say something about meat, and the Food Standards Agency has looked carefully at whether meat is a vector for transmitting, and I think the risk there is thought to be very low. So I think the meat itself is not so much the issue, but the environment in which this takes place is. And several features perhaps, and Chris may want to say more about meat processing factories. They're cold, and we know the virus prefers it in the cold. There's often difficulty in keeping people physically separated, so there's that whole problem of proximity. They're often loud, so there's often people speaking quite loudly, and there are places where people go and huddle to have their coffee and so on, and so there are places where people can end up infecting each other. So the environment itself is rather a difficult one in terms of the risk and the behaviours that need to be in place in order to reduce those risks. But Chris, you may want to add to that.
No, I think the only thing I would add to that is in many environments, it looks as if things like meat packing will be included in this, but also in places like healthcare settings, actually, very often the area of maximum risk is social areas or communal areas where people have food or have breaks. So it's important to think both about the work environment, but also the social environment around that work. Meat packing factories, abattoirs, and indeed food processing and packing areas have led to several outbreaks around the world, and therefore they are an area where we're going to have to take the mitigations particularly seriously. Thanks
very much, both. Can we go to Laura Koonsberg, please, of the BBC?
Thank you very much indeed, Mr. Johnson. The two scientists sound notably cautious this afternoon. Prime Minister, opening up does open up more risk to our health. Will you take responsibility whatever happens next? And Professor Whitty, you previously said very clearly you would like to see the 2 metre rule stay till the end of the pandemic. Have you changed your mind?
Well, can I say, Laura, that I think that it is absolutely right for everybody to be cautious right now. And I hope that everybody listening to what we've set out can understand the balance in this package and the need to have a gradual opening up combined with continued measures to prevent the spread of the virus and to restrict social contact. And that it's very clear that that is precisely how and why we're able to move forward with the opening up, the reopenings in the way that we are. And yes, of course, Laura, I take a responsibility, the government takes responsibility for these decisions. We're indebted to our scientific colleagues for their advice continually, but it is our responsibility to choose.
On the 2 metres, I mean, one of many answers which I've given in these press conferences where I've probably used rather more shorthand than I ideally would do. But as the Prime Minister made clear, the advice to stay at 2 metres if you can stay at 2 metres remains. So what changes is that there are environments where that isn't possible, and what the scientific environmental groups have looked at, and they looked at this very carefully, is if people take them seriously, if they apply them as best, properly, it is possible to reduce the risk in a very structured way down to something which is broadly equivalent to 2 metres. But that's not something in ordinary environments you're going to be wanting or needing to do. So, as I say, advice on 2 metres remains, and the 1 metre is a 1 metre plus mitigations which bring it into line with other areas. And that's why people must take it incredibly seriously.
Thanks very much, Laura. Can we go to Robert Peston of ITV? Robert.
Good afternoon, gentlemen. Can I ask all three of you whether we can expect any further relaxation of social distancing until we've got a workable vaccine, or you're confident that a majority of us are immune, which, you know, you've said in the past could be many, many months away? And secondly, specifically for the Prime Minister, what assessment have you made of the damage to the economy and the potential impact on unemployment of asking business to follow these rules?
Well, can I just have a quick go at both, and then perhaps scientific and medical colleagues can comment on the changes in social distancing themselves. But from my own perspective, and obviously we have to look at all these things in the round. The thing that's really changing at the moment is not just that we've got the R down, which is very important. We're also seeing a reduction in the incidence of the disease throughout the population. Robert, so when 4 weeks ago or so it was 1 in 400, it's now 1 in 1,700, and so as that number goes down or up, if you prefer, your chances of coming into physical proximity, physical contact with somebody else who has the virus, as those chances go down, then of course there will be further opportunities to vary what our guidance is and to try to get back to normal as fast as possible for as many people as possible. That will be the approach that we take. And our assessment of the impact of the changes that we're making today is, of course, that we hope that there will be positive and allow businesses to reopen in a way that, you know, if I think back even 6 weeks ago, when we first, on May the 10th, when we first set out this plan, I think a lot of people were saying to me at the time that we'd be hard pushed to get to opening up hospitality on July the 4th. So I'm pleased that we're in the situation that we are in that sense. I think that it's good that we're sticking to the plan. There will be, serious economic consequences, Robert, from the whole pandemic. There's absolutely no doubt about that, and we will manage those as well as we can. And I've no doubt that the UK will show enormous resilience and get through it very well. But this package, I believe, should be positive for business in the important sense that it combines reopening with the right degree of caution.
So on the issue about relaxation, obviously the final decision is for elected and democratically elected ministers. But in terms of what is going to change things over the next while, we are going to be living with this virus for a very long time. If we have to wait until natural immunity finally gets on top of this, we're talking about a very long period. Obviously, we all hope a vaccine will come earlier. So what might change over time? It'll include the epidemiology, and what goes down can go up. Winter, for example, may change that. It might mean that we actually have to increase some of the measures. Equally, it may be that the epidemiology gets better over time, continues the current downward trend, and we could go downwards. The second thing that will change is the recent thing, the thing that was published today on dexamethasone, is we hope only one of a whole series of scientific advances that will change our countermeasures and therefore our understanding of the risk. And then the final thing is that our science of the understanding of the virus changes. When we started off this pandemic, we really had very limited understanding about what countermeasures would work. We still have a long way to go in terms of learning all the details. Every few weeks, we have a different understanding of this virus. And therefore, as our understanding changes, our countermeasure changes, and the epidemiology changes, of course, there may be a possibility to relax some things, and there may be sometimes a need to increase others. So I think this shouldn't be seen as a static picture for several different reasons, but it's going to be a long haul, and we really, everybody standing here fully appreciates this is going to be a long haul.
Yes, I mean, I think this leaves us in some way in a limited number of options. Somehow it burns itself out and disappears. Seems extremely unlikely. And there's no evidence it's going to do that. And there's no particular pressure on it to disappear in that way. So I think it circulates in the way that Chris has said, and we may expect to get more of this in the winter. The second is that we do get a vaccine. And there are many vaccine projects across the world, some of them in the UK, and the most advanced probably is the one in the UK from Oxford. Those vaccine projects, of course, we can't bet on any one of them winning, but there are lots of them out there. So you'd be, I think, moderately optimistic that one of them will give something, but you don't know. And the third is, to Chris's point, to build on the successes so far, which is one drug which has antiviral effects of some sort, remdesivir, and seems to shorten stay in hospital. Another, dexamethasone, which reduces death in those patients who require oxygen in hospital. Those are building blocks that have come quite quickly, if you think about it, and we'd expect to get more of those that can gradually help. So those are the things which allow you to then limit the sorts of distancing we have, and as Chris has said, to build up a natural level of immunity is going to take a very long time. So I think we're with this for a long time. We hope that the vaccines and the therapeutics come along soon, but there are no guarantees on any of those. And therapeutics, we've got a building block, we've got a first step. Let's hope that that progresses more quickly to make this a manageable disease, which again would change some of the restrictions that you might need to apply.
Thanks very much, Robert. Sam Coates of Sky.
Prime Minister, the changes that you've announced today, particularly ending the 2 metre rule, only apply in England and not to Scotland and Wales and Northern Ireland. Why do you think that is? Are the leaders of the devolved governments making a political point, or just being glum buckets and scaremongers? Or do they just think that the science, which hasn't really been published behind this decision, doesn't support the conclusions you've made today? And to Patrick Vallance and Chris Whitty, you've been absolutely crystal clear that the risks from coronavirus haven't gone away, and your tone is noticeably more cautious than the Prime Minister. Firstly, how worried are you that the public reaction to this overall package might cause an uptick in transmission? And could you just put on record, do you both personally support the whole package, including the 2 metre thing, the 2 metre rule change? And did SAGE officially, fully approve the whole package of changes?
Well, Sam, I'm respectfully going to dissent from your characterisation of my tone today. I think I've been absolutely ruthlessly even-handed in the way that I've set this out. There is progress that we are making, important changes that we're able to make to begin the opening up of the economy. But I think I could not have been clearer that we must be cautious. And you'll have heard all the things that we've said about maintaining social distancing, all the mitigations for getting down to 1 metre where you can't do 2 metres. I think people will get the necessity for progressing with caution, which is what I'm recommending. On the 4 nations, look, all 4 CMOs, all 4 chief medical officers across all 4 home nations came together to agree the change in the alert level from 4 to 3, and there's far more harmony, believe me, between our approaches than you might sometimes pick up from some of the way it is presented across the scene, and I've no doubt that the UK will continue to advance in the same direction and at more or less the same pace. So obviously, as I said earlier, it is up to devolved administrations to make their own dispensations and make their own cases. Chris, sorry.
Well, maybe I'll start on the 2 metre, because I stood here before and said this, and the evidence is published actually, which is, as Chris said earlier on, 2 metres is safer than 1 metre if it's all unmitigated. But if you add the mitigations, and this is all in the papers that we've published, so if you start looking at things like orientation, are you side by side or back to back? Is ventilation good? Are face coverings being worn? Are other screens in place? Number of people in an enclosed environment is an important thing. You don't want to pack lots of people in, irrespective of whether they're 1 metre or 2 metres apart. The time in which people spend in certain environments and the environment itself, as we've just discussed in terms of the characteristics of that environment. Those are all features which are important. And what we've said in the work that's been done by the Environmental Modelling Group is that 1 metre can be, with mitigations in place, can be equivalent risk to 2 metres. And that's the basis for how you can make decisions, and those are then policy decisions on the back of that. In terms of SAGE is clearly not a decision-making body, it's an advisory body. The advice goes to all 4 nations and is used in all 4 nations and is consistent across all 4.
Thanks.
So I just add on an uptick, if people don't take the mitigation seriously, if people hear a distorted version of what's being said that says this is all fine now, it's gone away, and start behaving in ways that they normally would have before this virus happened, yes, we will get an uptick, for sure. So it is absolutely critical people stick to the guidance that's being given. It's a changed guidance, but there are still very significant restrictions socially, and there are very significant restrictions on business of different sorts. It's really critical we do that. There may well be upticks anyway. There certainly will be local outbreaks, as the Prime Minister has said. That is to be expected with this. Personally, am I comfortable with it? This is a balance of risk. It's like many things in medicine. You don't go in for an operation unless you absolutely have to. It's a balance of risk. And I think that this is a reasonable balance of risk. It is not risk-free. Absolutely not risk-free. Nobody thinks it is. And we may, at some point, say that particular bit of the decisions that were taken is too much of a risk with the benefit of hindsight, and we have to go back on it. But it is a balance of risk informed by reasonable professional judgments. As Patrick has said, the job of advisors is not to sign things off, it is to give advice. And then finally, I would just like to make a point, because I really want to praise the work of my fellow Chief Medical Officers across the UK. We have worked absolutely in lockstep. My first meeting this morning, before 9 o'clock, was with the Chief Medical Officers of the 4 nations, and my last meeting this evening will be a teleconference with them and many other senior clinicians. We really do work together. We share the science, we share advice from SAGE and elsewhere, we share intelligence and we share opinions. So I do not want anyone to get the impression it's perfectly reasonable for different nations to take slightly different approaches, but the idea that there isn't a technical underpinning, that is a shared understanding, I really would like to quash. That would be an incorrect impression.
Great, thanks very much, Sam. Let's go to George Parker of the FT.
Thank you, Prime Minister. Can I just follow up on Sam's question and put this directly to Patrick Vallance? I think Chris Whitty just gave an answer to Sam's second question. Do you support the decision the government's announced today to loosen these restrictions on July the 4th, including the 2-metre rule? And to you, Prime Minister, I was speaking to a Conservative MP today who said Britain is going bust. People are scared to go out of their homes, to go back to the shops and pubs. I'm a little bit unclear about whether you think it's a good idea to go out and about now. And if you do think that's a good idea, what can the government do to give people the confidence they need to get the economy going again?
Patrick, do you want to go?
Yeah, sure. So on the 2-metre, I repeat what I've said, that actually I think you can get to 1 metre with mitigations, which gives you the same risk as 2 metres, and therefore that's a perfectly reasonable approach to take, provided, as Chris said, the mitigation measures are properly applied and people adhere to them. So there is a way to do that, and that's what the new rules say. In terms of the package that's been announced, it is not risk-free. It cannot be risk-free. Every time you take a step to open up, there is some associated risk with that. The right way to deal with that is then to monitor, measure, and be prepared to take steps to reverse things as they need to be. So in terms of, is this package one that is reasonable and one that actually would allow you to do that and measure? Yes, you can do this and measure. And you need to be prepared where there's local outbreaks to deal with them locally. And if they become beyond local, then you need to deal with them at regional and national levels, which would mean reversal of some of the measures. And that is the only way in which you can then keep on top of this. So measuring and monitoring becomes an incredibly important part of this.
Thanks very much. Well, George, let me just say, I think it's great to see people out shopping again, and frankly, I can't wait to go to a pub or a restaurant, even if it may not be wholly compatible with the new diet that I'm on. And I hope that people will. I think people need to go out. I think people need to enjoy themselves and rediscover things that they haven't been able to do for a long time. And I want to see bustle. I want to see activity. But let's be absolutely clear that I also want to see everybody being careful, staying alert, and following the guidance. And so far, I think everybody has shown a massive common sense. They've worked together. They've stuck to the plan. We've got the thing under control. Let's keep it under control. We've set out a way of doing it. The guidance is there. Let's follow it, and then we can make even more progress together. Can we go to Mesa Hall of the Daily Express?
Thank you very much, Prime Minister. Good afternoon. To the scientists, you both said that we're in this for the long haul with many of the restrictions still. As this is the last of these daily briefings, what is your best guess at the moment at how long it's going to take before we do finally see the back of the hand sanitisers and the face coverings? Is it going to be years if we don't find a vaccine? And Prime Minister, to follow up on George's question, really, economic data suggests that many households who've been fortunate enough to stay in work have built up savings during the lockdown. Do you really want to encourage those people to get out and to spend and to get down the pubs and cinemas and hairdressers and make July the 4th a bit of a day of national celebration to kick off the recovery? And could I ask you, Prime Minister, what is the one restored freedom that you are most looking forward to enjoying again on July the 4th?
Sorry, Patrick, Chris, why don't you go first?
Well, I can't put a time on how long this will take, and I think that the ways in which we get out of this I've described, which are either it goes away, which I don't think it will, or we wait for a vaccine and therapeutics to really enable us to do it. We're on the way with that, with therapeutics. We're on the way with therapeutics. So there are some that does create an opportunity, and vaccines. There are projects in the clinic. And we need to wait and see whether any of those have got the right profile to work. And I think those are the key ways in which we think about exiting this. And I'm optimistic that somewhere in there, and I can't tell you exactly where, there's going to be some progress. And I think most likely in therapeutics to start off with, but fingers crossed one of these vaccines will come good. And I think it's highly likely that one of them will do something. And we just need to wait. I'm afraid it's a game of patience.
If I could, so I would be surprised and delighted if we weren't in this current situation through the winter and into next spring. I think then let's regroup and work out where we are. But I expect there to be significant amount of coronavirus circulating at least into that time. And I think it's going to be quite optimistic for science fully to come to the rescue over that kind of time frame. But I have an absolute confidence in the capacity of science to overcome infectious diseases. It has done that repeatedly, and it will do that for this virus, whether it's by drugs, vaccines, or indeed other things that may come into play. So, for the medium to long term, I'm optimistic, but for the short to medium term, until this time next year, certainly I think we should be planning for this for what I consider to be the long haul out into 2021.
Yeah, Mesa, as for all the things that I'm looking forward to, well, there's a very long list. I'd love to go to the theatre again. I'd love to go and see the Globe. I'd like to go to a restaurant, frankly. I would love to get my hair cut. I want to make one thing clear. I would love to play village cricket again. And I want to stress that we are working on all of these things. We are working with all the industries, all the performing arts, with theatres, with everybody, gyms, all the bits that we can't quite do at the moment. Sports such as cricket. We're trying to make it work as fast as we possibly can. So don't think that this package represents the summit of our ambitions. It's as far as we can go for now. But I want to stress again, we won't be able to make further progress unless we continue to work together to keep this virus under control. And as for July the 4th, well, I hope it will be a great day. But obviously, people have got to make sure they don't overdo it. And we can't have great sort of, I know that Chris is particularly worried about this, we can't have, great sort of writhing scenes in the beer gardens when the virus could be passed on. This has got to be done in a sensible way. People should be giving their names to the pubs, to the restaurants, doing things in a way that allows us, if something does happen, to track back, to test and trace and stamp out any outbreak. That's the absolutely crucial thing. So people should, of course, enjoy themselves, but as Chris and Patrick have said, this is going to be with us for a while, and we've just got to adjust and make it work. Let's go to Hugo Guy of the Eye.
Prime Minister, you've said that one of the new freedoms from the 4th of July is that people can go on holiday within the UK.
Yes.
Can people now also go on foreign holidays if they're willing to observe the 14-day quarantine when they return? And can I also ask Sir Patrick and Professor Whitty, are you both confident that the existing test and trace scheme is working properly and is efficient enough to crack down on any future localised outbreaks?
Well, Hugo, very briefly, as you know, the current advice is still that people should avoid non-essential travel, but we will be reviewing the situation on the 29th. We'll be looking at the quarantine rules and what we can do to create air bridges. So I acutely understand people's desire to do this and need to know. We will get on with it as fast as we can. I think that it is very important for every country that has really successfully cracked down on this that we do have arrangements to stop the virus being re-imported into the country, and that's why it's necessary to have quarantine arrangements. But I'd also say to people, this is a fantastic country to go on holiday in. And, there should be, I wouldn't hesitate to recommend staycations as well.
Test and trace is already doing a lot, and that will be having an impact on reducing infection. The biggest thing that I worry about, if I'm honest, is that people don't report that they've got symptoms, so get a test, and then if someone is contacted by the NHS test and trace, that they don't engage properly with that process. By reporting when people have got symptoms, getting a test, and if it's positive, isolating, that is a huge service to the rest of society, because that is the way that we ensure that people who have got the virus or might have the virus get out of circulation temporarily, and that reduces the risk to absolutely everybody. So I would really want to stress the importance of people engaging seriously with this. And Baroness Harding, Dido Harding, who's actually leading this, made clear right from the beginning that it would take a while to reach cruising altitude for this. It is improving every day. I see the day-to-day on this. It will continue to improve over the summer, and it's already making a contribution. It will make more of a contribution, and in due course be a very major part of our defence against the return in a big way of this virus. But it does depend on people really engaging with it and engaging with NHS test and trace from the symptoms all the way through to the isolation.
Brilliant. Thanks, Chris, and thanks, Hugo. Let's go finally to Jessica Frank-Keys of the Eastern Daily Press.
Prime Minister, at the Eastern Daily Press in Norfolk, I've written a series of reports into a generation of our most vulnerable children and young people being failed and forgotten during this crisis. Experts fear the scale of the fallout on those already most at risk is being masked, with warnings of lifetime consequences for children trapped in abusive homes, cut off from support services, and facing widening attainment gaps from wealthier peers. You've recently become a father again, and these systemic disadvantages are challenges your son will never have to face. You've applauded footballer Marcus Rashford's personal campaign to ensure no child goes hungry this summer, but these problems existed before the coronavirus crisis hit. I know the government has launched the catch-up scheme, but what will you personally do, and what long-term initiatives will you bring forward to tackle these ingrained inequalities and ensure no child is forgotten?
Well, thanks very much, Jessica. And look, I totally agree with you about one of the most unfair aspects of this crisis, which is that obviously the disease has been discriminatory in the way it's hit certain communities, certain groups of people.
Well, if you want to continue watching this final coronavirus briefing, you can do so on the news channel. But now
unfair in the way that it has impacted on young people's and children's education. And there's no doubt, if you look at what's happening at the moment, one of the saddest things is that it's kids from deprived backgrounds who really need to be back in school, who perhaps aren't going back into the primary school classes that are open in the numbers that they could and should. And we really want to urge them urge all parents to get your kids back into school, into early years reception, year 1, year 6. They're there, and we're encouraging primary schools to take more if they can, more more children, more pupils if they can fit them in, because that's about social justice, Jessica. It's very, very important that kids get access to education. It's also important, you'd ask what I'm going to do personally now. We've got to look at what's happening across the whole of the country, and there are areas of the country that do need more investment in their schools, in their school buildings, and we're going to be doing a lot on that, in the local infrastructure, in rural broadband in Norfolk, and we're putting out a huge programme to get rural broadband in, such a vital thing for communities across the country that are more remote or have been left behind, but particularly for young people, for children in school who've been left behind, I want to see much more direct contact with teachers, so that more one-to-one tutoring of the kind that we're now supporting through the catch-up programme that Gavin Williamson has instituted. I really think that that's very, very important, not just for kids who are falling behind, but for all kids. I think it'll make a huge difference to their lives. So those are some of the things that we're doing. Thank you very much. Thank you very much, Jessica. Well, listen, I think we should probably conclude it there. I just want to say a couple of quick things in finally. All kinds of things have changed since this virus emerged in our understanding of the virus, but some important things have also changed in our ability to fight it. And I would mention, obviously, the huge efforts that the public made to control it, but also the appearance of dexamethasone, remdesivir. Perhaps there's more potential for packages of drugs, in the UK playing a lead role, particularly in dexamethasone. Also, test and trace. This can be, as I said many weeks ago, this can be a real game changer for us. And the activities of the Joint Biosecurity Centre also make a big difference. So although the virus is the same and it's just as dangerous as it was, we're now better at dealing with it. And I think that should be giving people much more confidence now as we go forward. But as I said, as I've said throughout this press conference, this virus is still out there. The only way to beat it is to stay alert, to follow the guidance, and to save lives. Thank you all very much. Thank you.
See the headlines as they happen and watch BBC News live in the app and get the full story with bbc.co.uk/news. Follow the story for all the latest with BBC News.